When things go wrong. Doesn't happen very often with the immune system. Allergic reactions, that's when we're exposed to an allergen, usually a foreign protein, say pollen or a bee sting. IgE antibodies in our bloodstream bind to mast cells, and with this complex, histamines are released. And when histamines flow into tissues, that triggers inflammation. Anaphylactic shock is just an extreme allergic reaction, where histamines and prostaglandins flow into the bloodstream. Capillaries begin to open up at their creases, leak plasma, so that we're getting swelling or edema. The arterioles are dilating, so that increases the local blood flow. So it feels warm and it's swelling. Problem with this, okay, the body's trying to attack a foreign antigen. However, with this loss of plasma, the blood volume suddenly plummets, and we enter into stage 1 of shock. Compensation. Most people are unaware of this stage. This is where the heart is attempting to perfuse blood throughout the tissues, and in order to do that, it has to increase its pulse rate and breathing rate. In the second stage, the heart is losing its battle. It's life-threatening because the heart is attempting to perfuse blood, but the blood has become thickened, and it's gradually losing the ability to perfuse blood throughout the body. Finally, we arrive at shock, and this is what most people think of shock or hypoperfusion. It's a dangerous stage, but for a health professional, such as myself when I was an EMT, it's far too late to start looking for stages of shock, because a person, especially a young adult or a baby, or someone who's elderly, can die quickly on you. In this case, there's toxins, carbon dioxide building up, blood pH drops, so we're getting acidic blood, and sometimes the airway closes off and the tongue relaxes. In autoimmunity, that's when the body attacks itself. Osteoarthritis is where we injure ourselves at a joint. The macrophages go to work attempting to sculpt some of that torn cartilage, and in the process we have inflammation and pain. This increases macrophage activity, which increases cartilage destruction because the macrophages are removing some healthy tissue as they sculpt. Soon the cartilage gets thin, we have more pain, and we end up with a positive feedback loop. Pain, less cartilage, more macrophages, until the tissue is very, very thin. There it is. Don't get caught up in this loop. It's easy. Sometimes it takes 10 years, 15 years after that initial injury for the pain to appear. Rheumatoid arthritis is a similar process. It's a positive feedback loop. In this case, macrophages and T cells are destroying cartilage, and the joint space fills with synovial fluid and dead skin cells, cartilage cells. The body responds to this pain and inflammation, sometimes by forming bony spurs, which unfortunately the body is attempting to fix the problem, but it makes the problem worse because we have increased pain and inflammation, which increases macrophages and T cells, and on we go. Here's an example of rheumatoid arthritis. You can see that bulging synovial pocket there that's often filled with cells and synovial fluid, typically caused by genetic predisposition rather than injury. Systemic lupus, there's the classic butterfly shape on the cheeks, although it's not always this way, because in lupus, B cells mark different tissues of the body, and just about any tissue is at risk. Skin, kidneys, DNA often are early targets. In diabetes type 1, diet, lifestyle, viruses, or other factors can cause the immune system to target the beta cells of the pancreas. And these are the ones that secrete insulin and regulate our blood sugar. Multiple sclerosis. Consider if you took a power cord and started shaving off the insulation. Pretty soon, electricity would not reach the lamp or whatever it is that you were trying to use. And that's the way it works here. The immune system targets myelin, and that's the sheath that insulates axons. Typically, the motor neurons, the impulses start to scatter, and so the impulses never reach the target tissue, such as a muscle, and so body movements become difficult. Immunodeficiency, just like the name suggests, is when the immune system is compromised. AIDS is probably the most common or familiar example. What happens is the virus enters a body through infected blood or our body fluids, and then B cells release antibodies. And this is our body attacking, and this is the body doing what it should do. And at this stage, we can detect an HIV infection by doing a blood test. Soon, the virus enters the cells of our immune cells and attaches to the DNA. Now, the way it does this, viruses have a RNA, or a single strand, but they have something called reverse transcriptase. It's an enzyme that allows the RNA, a single strand, to convert to DNA, which is a double strand. And now they can attach, and then each time our cell divides, the strand of HIV divides with it. This is the window phase of a lysogenic viral pathway. It's called window because there's really no symptoms. Soon, a lytic phase begins, and that's when that DNA becomes activated and it starts to command the cell to make more viruses. So our body becomes a factory, an HIV factory. So if you eat a hamburger, that hamburger, some of that turns into HIV in our cells. And then they outbreak by budding from the infected cell, and they move on and infect other cells. Symptoms, well, early symptoms are the blood is being filtered by lymph nodes, and so we get masses of infected cells clustering there. Over time, few macrophages and T cells are left because they're being destroyed. As these cells disappear, we enter systemic sorts of symptoms. And enlarged lymph nodes, because they're impacted with infected cells. And finally, this picture is to sober us up. We see lots of Hollywood movies with promiscuous behavior, but sometimes there's a price. Because without T cells and macrophages, we cannot combat just simple diseases like pneumonia, and we can't keep cancer at bay. Nice review here. Allergic reactions, IgEs, those are the immunoglobulins, attached to a mast cell, release histamines, which initiates inflammation. Anaphylactic shock, a type of allergic reaction. Histamines and prostaglandins are released, causing arterioles to dilate or expand. Increases local blood flow as plasma flows into tissues. Problem is blood volume drops. First stage of shock is compensation. Breathing rate and heart rate increase in an attempt to perfuse blood. But this fails in stage 2, where we have low blood pressure, low blood volume. And if this situation is not corrected with something like epinephrine or sometimes oral Benadryl can work, although that's slower, we enter shock or hypoperfusion, and that's where the blood is becoming rapidly acidic, the pH is dropping, CO2 and other toxins are building up, and we have a life-threatening situation. Don't ever let a person get this low. Catch it early. Catch it at the very start in compensation. Rapid breathing, rapid heart rate, think shock. Don't wait for the third stage. This is the stage that everyone looks for, but it's the stage that's too late. Autoimmunity, so that means self-immunity. We're attacking ourselves. In osteoarthritis, we're attacking cartilage at the joints. We end up with a positive feedback loop because injury increases inflammation, which increases macrophage activity, which all bring it back, and the cycle continues as the cartilage thins out. Rheumatoid arthritis, similar process, but in this case, the collagen in the joints starts to fray and scatter into the joint, and we get swelling of synovial fluid as the T cells and macrophages go to work. Positive feedback loop, it has to be interrupted. That's something like Celebrex or NSAIDs or other means. Got to break that cycle. Systemic lupus is caused by B cells that attack just about any cell in the body, but common are skin, kidneys, DNA. Diabetes, mellitus type 1, it's an immune response to our pancreas, specifically the insulin-producing beta cells in the pancreas. And this causes problems with blood sugar. Multiple sclerosis, that's the myelin sheath that is being destroyed by our own immune system. Why does it do that? Well, the researchers are still not sure, but viruses or other triggers that cause it. Motor neurons are destroyed and the impulses never reach the target tissue. Finally, immunodeficiency. Here, B cells, in the case of HIV, B cells are infected and eventually macrophages and T cells are destroyed. And they're destroyed by a virus, a very insidious virus that enters our own immune cells, uses a transcriptase to convert to a DNA, and then it attaches to our DNA, quietly dividing in a lysogenic window phase, and then becoming active, producing lots of HIV, billions, in fact, per hour. Can you imagine that? Billions per hour. Outbreak, it buds out of the infected cell. We start to get cellular masses in the lymph nodes, and eventually we succumb to common diseases such as pneumonia, or Kaposi's sarcoma, cancers, all sorts of other diseases. Don't let this one get you.